So I'm going to ask the panel if they can switch their videos on so that we can see who you are. And if you'd like to then, I don't know who wants to kick off, but if you'd like to start maybe engaging with some of the presentations that were put to us. So ethics panel, if you can put your videos on. Thank you, Giles. Who else have we got on the ethics panel? Thank you, Jimo.
And I think my camera's on, Patrick.
Patrick, thank you. Yeah. Kaz, who else do you have on the panel?
Thanks, Kathy. So we've got Felicia, we've got Jimo, Patrick, Giles, and Wanda.
Okay, Wanda and Felicia, if you could put your videos on, please, if it's possible.
Felicia's on.
Yeah,
I can see her.
Mine's on.
Oh, okay.
Yeah,
it's just the way Teams works then.
Okay.
Yeah. It's happening the same to me, Kathy. I can't see everyone's face, but probably it's changing for different people because I can only see two of them. So yeah, that may be Teams.
So the panel, you've got about 35 minutes till approximately 1:45, 10 to 11 Irish/UK time, to engage with the presenters. But I would also encourage anybody else to please write your comments, your feedback into the chat, and we'll have a few minutes at the end to engage with some of the comments. But any comments that have been contributed in the chat will also then be collated afterwards and fed back to the research teams. So please do, feel free to add into the chat. But otherwise, over to you, panel.
Shall I start? I don't mind. Well, thanks, Kathy and Kaz and everybody. I mean, I was really impressed. As an academic, we go through this process from the other side of the side that you're on when we submit our proposals, and then we have an ethics panel that sits and pulls them apart, and we all come back and have another go and all the rest of it. But in the end, it just leads to better research. So I think it's great that Christian Aid and partners have taken this on seriously. I also like the ambition, I think, to try and make this not a kind of London-centered, UK-centered view of, or even a university-centered view of what good ethics is about, because I think although there are standards and procedures that would cut across any form of research, I think there are nuances and differences around this kind of research that I think is getting picked up as well in this process. That was really good. I've annotated the four. Is it four? I think the four proposals. I can circulate those via Kaz. But it did strike me when I was reading through them. There's a number of similar questions that I was writing in the margin. So in a sense, I thought I'd run through those without. But it doesn't apply to everybody to the same extent, and so I can nuance that. But rather than go through case by case. So I thought all the proposals were really interesting. I think there's a good mix of methods that are going to get to some of these quite difficult issues. I thought in most cases the details of the data collection could be a bit more elaborated. So I wasn't, when people say I'm going to do key informant interviews, it was like, well, not quite sure how many and who with. And so I think it would be looking for a bit more detail on there. In most cases, the survey size wasn't stipulated. I think that the Myanmar team did say they would do about 380, I think, which is great. But I think, again, those kind of details are really important in terms of thinking about, how much data you're going to collect, how difficult it's going to be to process it, how much protection and when you pass all that data around different machines and different people. I thought there was also some did and some didn't the safety of research teams. I mean, that's an ethical issue, as you can't just send people out. There's COVID around, there's conflict situations. Again, some people did mention that, but not all, about how you ensure the safety, both of, there was good safety for the participants in the codes of conduct and things like that, and that's great, but also your researchers need to be part of that protection, I think. Something I'm always getting asked in my ethics thing is like, how are you going to, if you've got a big team of lots of people collecting data, how are you going to make sure that everybody adheres to the ethical protocols. You've got these great ethical protocols, but you've got 40 people or 20 people or 8 people collecting data. What systems do you have in place to ensure? So it's not just a one-off training that goes, okay, here's the 10 things you need to know about, go off and do it. It's kind of what's the process within the research that's going to monitor that and check that that's happening on a regular basis. And that's something that I've kind of often not dealt with, and now I'm kind of realizing I have to have a regular ethics check on our meetings when we update the research. I also thought there was an issue about sensitive issues. So you're talking in most cases about people with disabilities. There's going to be issues of stigma. Again, it was kind of just said, oh, we're going to discuss, the problems that people with disabilities face in accessing services. Great, but then you're going to be dealing with very, emotive, quite disturbing, issues, and I didn't see, how is that going to be dealt with in the context of a face-to-face interview? How are you going to ensure that that's not done in a public space where people can see other people in distress or whatever? Again, some of you did, some of you didn't mention the data processing, so around anonymization and transcription. So you're going to get tons of data, which is great. Then how is that going to be processed to ensure that there's anonymization in that you protect the identities of those people? And I think that leads to Kaz's point towards the end was like the ethics applies to the whole process. I think I thought all the advocacy plans and the communication plans were fantastic, and clearly I really like the way that you'd use those kind of stakeholder analyses and influence maps to look at, well, who do you need to speak to, how do you need to speak to them, what forms are you going to influence them, but how is the data then going to feed into that? So if you're using images of people, how are you going to ensure that those images are not compromising any ethical protocols, and people aren't going to be identified from anything that you can see in those documents? But I mean, there were a fantastic range of ways of engaging, and I think in a few cases I thought the Nigeria presentation just now was very clear on this actually, but it wasn't so clear from the documents about how you actualize your ethics plan. So there was the Singapore protocols in one of them. Fantastic, great set of protocols, but there's the kind of boring, or not boring, the nitty gritty of, okay, well, what does that mean in practice then? How are you going to do that in terms of, consent forms, ethic, how are you going to do all of that in the actual process? So I guess those are but in general, very impressed. So they sound picky, but I think there were kind of things that I found across a number of those proposals. So thank you.
Okay, thank you very much. Can I
go for it?
Is it okay? Can I also contribute?
Yes, please go ahead, Jimo. Yeah.
Okay, thank you very much. And first, I need to thank everyone for the beautiful presentation. I think the research proposal was very explicit and straightforward, and with a lot of very interesting research questions. Maybe I should go country by country. Let me start from my country, Nigeria. Thank you for the good presentation. This is I think among all the research proposals, this is the only one that will involve children. And it's more explicit how they are going to get those kids, say 13 to 19, some of them are still underage, and how they are going to get informed consent from those children. Are they going to meet them at school or out of school or within their community? So they need to reconsider that very well and have a very good layout plan on how to process informed consent for underage. Then also, I think this is also general. Others have also been talking about people living with disability. We've not been taking cognizance of different forms of disability. I think there was only one proposal that mentioned people with cognitive impairment will not be included. So what about other categories? It's going to be diverse category that almost every forms of disability will be included. I think most of the research proposals need to be specific about all this. Then also for the Nigeria, they should take note of the local context in the review process, so that at least include some Nigerian authors and also consider those that actually have written about Nigeria. And the presenter mentioned something very important, talks about the opposition that exists in Nigeria, and when you are going to measure public services, then people might think you want to assess the government, and we have the issue of the two big parties. They always be suspicious about this kind of project. So the question is, they need to take care of how they're going to resolve government interference, possibly, and also after the research, acceptability of the research output. This is very important because this is the kind of research is moving from practice to from just research to practice. So they need to take care of this. Then they mentioned something in their sampling method, which is stratified sampling, that they are considering this. And I think the group is already a marginalized group. You don't need to stratify them further. So they might need to rethink about this and adopt another research sampling method. Then I think the only contribution I have for CAS is that of local content and local context. Since the research is mainly secondary data analysis, so it's not the that idea looking at the country from other perspective or from just foreign perspective, now to look at the local research, the local context, and to make sure that there are a lot of local content for all the countries, so that in order to promote acceptability. And for Yemen, extensive research questions, quite a number of them. I don't know how they're going to measure them because they are probably too much, because every research question is broken down into almost 3 or 4 other categories, which at the end of the day might be too much. Someone would say, for those of us in academia, we always say, okay, what is about research is doing so much about something that is so little, so that we can get better understanding, and the output will be meaningful to address specific issues. And they also mentioned that there might not be use of random sampling method, and for quantitative research, they have to rethink about that very well, because for the result to also be acceptable, then they need to follow these rigorous steps. Of course, you can use other forms of non-probability sampling method, but it has to be well explained, and there should be strong justification for doing otherwise. If not, people always expect that use probability sampling method in quantitative research design. So for Zimbabwe, they mentioned National Statistics Office, their involvement in the study. I wonder how they are going to do that. Thinking of this is a kind of assessment, literally. So what about the issue of public trust from the participants? And also, it was read that these are government officials. They are not going to manipulate some of the results, at least to tell you what they actually want you to know. So you have to be very careful in involving why, of course, they should be carried along. Advocacy is very important, but in actual data collection, we need to rethink involving the government agencies. You can actually interview them, but for them to participate directly in collecting data, that's what I'm referring to. For most of the research proposals, you basically mention that you're going to respect informed consent or ensure informed consent, but there's little about documentation of informed consent, and also, is there any way in all the research proposals, of course, except that of CAS, there will be use of incentive, and how this also has to be, because sometimes when you interview for key informant interview, for instance, for IDI, in some cases you see giving some minimal incentive, but I think none of the research proposals mention the issue of incentive, which is also very, very important. Because it shouldn't be too much, it shouldn't be too little. There must always be a balance. I think that's all I have to say for now. Thank you.
I'll just jump in, I guess, as I think we're just.
Thanks, Felicia. Thanks, Jimo, for your feedback. Please jump in, yes.
Now, thanks everyone for presentations. It was really interesting to hear about the different aspects, and I can definitely see how they kind of fit together around research for. I think, yeah, I think one of my I guess the considerations was really thinking about, a lot of these studies are looking at what are the barriers for accessing services, and I was really thinking about kind of two aspects in particular. One was around, what happens when people from interviews are talking about specifically experiences of violence and rights violations, and how, what's been put in place or will be put in place around referrals or access to justice, because and then that kind of goes back also to Giles' comments around confidentiality and anonymity. What does that space look like when people are being interviewed? So I was really thinking about that around, people with disabilities, the violence people may be experiencing, and that's both also from that stigma and discrimination aspect. And then in regards to services, I wasn't clear about what setting. It goes back to the setting that interviews would be taking place, because if we're talking about healthcare settings or other settings, I'd be concerned about people feeling like they can't really express what's happening because they might fear kind of implications from that setting. If I'm saying, oh, I'm being discriminated against, or just that fear of not even getting the services that they barely get anyway. I think that kind of retribution, perhaps. And then there was another piece, so I think there was elements of safeguarding that was mentioned in every one of the proposals, which is great. So I think it's just a little bit more detail about what that means. And then I was just also really thinking about the gender differences amongst the populations that we're looking at. And how, I think just more and more, there is, we can't look at a population without looking at the gender differences and being more, I think, explicit about that, because I think, even with COVID-19, we've known that, women have experienced more gender-based violence or violence because of lockdown, loss of economic opportunities, and just kind of that whole thread around those differences. What other pieces? Yeah, and also I think maybe my other comment would really be, and sorry, this is quite general, so it kind of, all of these apply to some have, like Myanmar spoke about looking at the different gendered pieces, others didn't. I think, and then I think just around the advocacy and kind of linking the results. One was around just feeding back to participants. I think that wasn't clear in each of the proposals. They might be there in the thinking, but it wasn't explicit. And then I think with engaging in kind of the existing mechanisms, so that was great. Kind of how do we engage the results? Use the results of the studies to existing platforms and structures. And I think it would be interesting to also, I think there was, I did see kind of cross CSO engagement, but also linking kind of some of these results with other groups who are working with marginalized communities to kind of really bring together those shared threads. I thought would be quite a powerful way also to gain attention and hopefully mobilize governments to act. So yeah, those are, I think, my kind of overall thoughts at right now. Thank you, everybody.
Yeah,
Thanks,
thank you.
Felicia. Wanda or Patrick, do you want to come in?
Yeah,
Let me.
in, or you can go first, Wanda, if you're ready. I don't mind.
Okay, thanks, Patrick, and also thanks to all the colleagues who presented. Very interesting to listen to the various countries thinking around the inclusion issues, and I think for me that's the programming element that's really missing sometimes when we try and respond to issues of let's say service delivery. We kind of categorize everyone, and we miss out on the marginalized. So it's good to listen to all of you responding like that. And I really agree that this study is a bit different when you look at the disability sector. They are already marginalized in terms of gender. I think we've spoken around it in terms of their disability, in terms of poverty levels. So we need to be thinking through as we are doing our questions to say this is not our normal study that we're doing. So thank you very much. Also, I got the impression that, not the impression, this will be a kind of advocacy work. How are we going to use our data for advocacy? And it's very important that we've already identified our stakeholders and so forth, but it may also be necessary, I think, for the different country programs to already think around the groups that they will advocate towards. I just thought through for maybe the Zimbabwe scenario. We have traditional and cultural and even faith-related issues to disability. So in your stakeholders, you also need to think of the traditional leaders, of the faith leaders, who sometimes are the culprits in terms of leading to marginalization of people with disability. Nigeria, I think that issue of working with children, thanks, Jimo, that important that we look at that. Then there's something, I think maybe I'm talking from a programming point of view. This study is likely to be done under COVID circumstances. And there are the issues to say how much COVID awareness, for example, some may have to go and do the physical meetings. There are the issues of masks, the issues of sanitizers and all that. If you need to go and do that, please, I think it's the responsibility of us as researchers to ensure that those things, social distancing, are in place. Then I think my colleagues also spoke around doing a study in fragile states. It's very different because they are already either conflict issues that you need to be aware of within your context. So you need to look at that. Then of course, the issues of technology, access. I saw some of you putting in Kobo and so forth. My experience on the ground is that because of the COVID lockdown, we have designed questionnaires where, of course, our target group sometimes have smartphones, but trying to ask a community member to complete a questionnaire on a smartphone without, I mean, all of us, because we've done research and we know these things, but even, pointing at the right place and clicking and so forth. So invest a bit if we're going to use this modern technology, and obviously the issues of connectivity and data become very important. So for me, it's ethics in the face when we are not doing face-to-face interactions under COVID. Let me just check. We talked about stakeholder analysis. Then also sensitivity. I think because we're dealing with people with a disability, we're going to have helpers. We may ask a helper to say, what is this question? We need to be sensitive to people who live with people with disability. If we ask them questions in the survey, what are their expectations as well? My experience has been sometimes the person who is helping a person with disability also has expectations, so clear them out before involving them in the survey. But otherwise, I think it's a good mix of the study areas, and I'm looking forward to this research. Then lastly, I think for me it was also to look at the rural and urban divide. I don't know whether it is going to be the same through some of the countries, but it could be the same. Zimbabwe, Myanmar, Nigeria, that rural urban divide, it has its own dynamics as well. So yeah, thank you very much.
Thanks, Wanda. Patrick, you're on mute.
Sorry, thank you. Always one. Yeah, thank you very much, Wanda. I had a few recollections. A lot of what I was going to say, I think, has been covered by a lot of the rest of the panel. But I really enjoyed reading the outlines of the proposals and also listening to the presenters today. I don't know a lot of the people on this call, but I work at SOAS and I'm working on a project that's focusing specifically on issues around drugs in conflict-affected areas in Myanmar, and especially engaging often with people who use drugs. So it was really interesting to see how all of these different proposals are also grappling with issues of the ethical sensitivities about working with marginalised groups and some of those issues. So I thought I would raise a couple of issues that came to me as I was reading the proposals that also bear out of my own experiences of trying to manage ethically quite sensitive issues and projects. I think the first issue that came to mind when I was reading through the presentations was that there seems to be a big focus on trying to have a sort of strong advocacy component around engaging with government or other service providers in order to take the issues around the challenges that people with disabilities are facing. And I was wondering whether that requires specific ethical approval from governments in the countries that you're working with, and how there's potential there for tension between sort of the formal ethics approval in order to get governments to engage with your work versus your own ethics in terms of working with populations. And I think that might just be something to be aware of as you go through the projects, the potential for tensions within competing ethical kind of guidelines and pressures. It's certainly something we came up with in our project in terms of the challenging. Government would only engage if you had ethics approval for certain parts of our project around health work, but some of that approval from government came into some quite conflict with how we were trying to work in a way that we felt was much more ethical in terms of more bottom-up approaches. So that might be something that we'll come across. I think the other issue that I was interested in, and it's something that Kaz made me think of when you were saying that this project is trying to bridge sort of both academia and practice, that I think a lot of the challenges sometimes I find I face in terms of the ethics of doing research as an academic is it's quite hard to have a clear explanation of the impact that your work will have or the change that it will have. That you obviously have aspirations of the impact that you want to have, but at the same time it's being quite frank with the people who you're hoping will open up about their personal experiences or give you their time around what the purposes of the research are and what it can and what it can't do. I think I certainly found that with kind of, like I was saying, with academic research, that sometimes it's being clear that this is about trying to improve understanding and knowledge, but it isn't necessarily automatically going to lead into tangible changes that will be seen quite clearly. So I think trying to get that balance right is also quite an important ethical consideration. And I think the way that we tried to deal with that was at least have a strong commitment to sharing findings with the people that we worked with in doing the research. And I think as much as all the issues around consent and anonymization and all of those aspects of ethics are really important, I think there's also a strong ethical component about not going collecting research and then sort of not going back into the communities and the people that you've worked with. So I think that is another way of having an ethical commitment to the people that you're working with, even if you can't guarantee that the work will necessarily lead to tangible changes. I think the other issue, which I think already came up, I think it might have been Giles or Felicia was mentioning, or maybe both of you, was that I can imagine that the subject and the issues that you're dealing with are hugely emotive and can bring up probably some quite harrowing experiences of people if they share, whether that's stories of abuse, of discrimination, and thinking how you manage that. I think, Felicia, maybe you were saying in terms of support that you can guide people towards, but also maybe going back to Giles's point as well, the sort of the support for the people who are doing the research themselves, that it can also be quite kind of, you can suddenly get into an interview that gets very deep and very intense, and thinking how you manage that, because it's how you leave that interview then, in that sometimes you feel you've left the person you've interviewed in a worse place than when you began in terms of the emotions that you've brought up. So I don't quite know how you manage that, but I guess maybe having some thought process in place, especially if you're working with quite large research teams, about how you manage that within the organizations. Because for us, that was one of the big sort of ethical issues that came up in the work that we were doing. I guess the final point was also thinking about whether, and this may already be part of the project as well, I didn't see it so clearly in the proposals, but how the research itself and the advocacy can itself be a form of empowerment and engagement for people living with disabilities. That a lot of the proposals are around understanding the problems that people with disabilities encounter, and then trying to engage government or service providers to consider those issues. And I wonder how much of the proposals are also looking to incorporate working with people with disabilities in terms of then doing that advocacy work. So rather than doing it on behalf of people with disabilities, doing that advocacy work with people with disabilities and trying to incorporate them into some of that work. But I think I'll finish there, because otherwise we'll probably run out of time. But there were a few issues that came up. And thanks again to all the presenters. It was really interesting.
Oh, thank you to the panel for their feedback. We've got about 10 minutes where I'd like to open it up to the presenters to maybe to respond to the panel, but also to everybody else if you've got questions you want to ask, or things that you think that need to be considered in the proposals, please feel free to raise your hand or to write it into the chat. And just maybe one thing I would maybe ask the researchers to think about also is to all of the research is being carried out in conflict-affected countries and deeply divided societies. And so I think there's something also just to think about in terms of reflexivity. Who are the who are the enumerators? Who are going to be the people doing the interviews, and how does their identity, their community background, whatever it is, interact with the participants? And so I think, I mean, we can unpack that a lot more, but I think just thinking about what the research means, who the people are in the context that you're working with, and just thinking about the conflict dynamics that are there. So let me open it up first to the researchers and the presenters, if there's anything you'd like to respond to. So Judith, Uzo, Dancing, Kaz.
Thanks, Kathy. Can I come in?
Please, yeah.
Thank you very much to the panelists for the invaluable contributions, which we are going to take consideration of, and definitely the inputs are going to improve on our proposal as we move forward. Maybe I just wanted to respond to an issue that was raised by Patrick, which I think is very important, on the conflict that might arise in terms of engaging government. And maybe just to share with the group that, for example, for Zimbabwe, as the Poverty Reduction Forum Trust, we are also within the ECID consortium as a technical partner. So what we have done within that role was to sensitize government line ministries and parliamentarians on the ECID project as a whole. And we believe that in set ground, and within that engagement, both the ministry representatives and parliamentarians raised issues with us as a project in terms of their expectations as well, which we have shared with the consortium. in terms of laying ground. So we think we have started the process of sensitizing them, and they are waiting to see the project rolling up and the findings. And also we see this research as informing the programming and advocacy that will be done by the consortium members who are implementing on the ground, which will lead to the issue that was raised about empowering the communities or the respondents to the research, because we believe that the findings now, the research, the consortium members will take up the issues and infuse them in their programming. So it will help with empowering. We are hoping it will be able to work in that regard. And then there was an issue that was raised about, I think, GBV, gender-based violence, somewhere. And we, in our case, we are going to provide participants with a list of relevant referral services in the event that they show signs of distress. For example, in Zimbabwe, we do have organizations like Msasa Project that works with gender-based violence victims. So those are some of the cases or referrals that we will be able to give to the respondents who might show those signs. And also during the process of training the enumerators, we will look at being able to discuss with them signs of seeing that somebody is in distress, and discuss together ways of managing that, as well as giving those referrals in terms of helping where it is necessary. I think I'll end there for now.
Thanks, Judith. Uzo, Dancing, or Kaz, do you want to give a response?
Yeah, thank you very much. Thank you, our ethics panel, for the wonderful contributions and some issues you raised. I'm happy I've noted a lot of issues that have been raised, especially with details of data collections. Yeah, we know it's still scanty and we have to get that elaborated. And also the absence of sample size in some cases, those are going to be taken care of. I did not submit my research ethics earlier, which will be circulating after this. Yes, we talked about safety of the research team. We take that one seriously, and I think it's also something everybody should consider, every research team should consider, especially in the era of COVID and other things. The ethical protocols, in terms of monitoring standards, you don't just send people out in the field without making arrangements on how to and to make sure that they are doing what you told them to do. So we are going to take care of that too, and I encourage my colleagues to also adopt that. I'm also very impressed with it was particularly striking the angle my colleague Jimo brought out, and I think we are going to look at it. We had a discussion on it with my director yesterday. Yes, especially with children. Since we are dealing with teens between ages of 13 and 19. When you mentioned that, it struck me immediately, and I noted it because we are going to have it. They getting the consent. We have planned that we are going to use their school, so maybe we have to have a discussion on whether to get the consent of the principal of the school or the headmasters or the headmistress. And I believe when we sit down and talk with the stakeholders, we'll be able to arrive at something that will please everyone. Also, you mentioned in looking at not just disability as a whole, but the different types of disabilities. So we're also going to take note of that. Another interesting issues I learned is the local content and the local context, which is very, very. Our own is a bit different because it's a kind of data-driven research. We want to build a bank, and for you to be doing that, the local content and the local context must be well considered as well as the local politics, like you mentioned, the party, the opposition, and all those things. If not, at the end of the day, the research may end up in one shelf and nobody is going to use it for anything. We are thinking seriously in that line to make sure that we take care of that, and that's why we are having a wide range of stakeholders, not just non-governmental but government. In the two states, we are having the Ministry of Budget and Ministry of Planning heavily involved in everything, including in planning. In fact, we will use some of their staff as enumerators to make sure that there is this buy-in, that these information are not for any political reason, but also for the improvement of welfare in the society. Yes, somebody raised about giving voice, and I think if that's the case, we captured that very well, because we are not, the research is not about advocating for these particular groups of marginalized people. We are trying to do a research on how to give them voice to advocate for themselves. So it's a kind of empowerment. Some of them don't know that they have the power to be able to say things that will improve their lives. So I think the focus is on voice, giving them voice, and not just advocating for them. Somebody raised, the last speaker raised something on managing expectations, because like he said, you may leave a respondent more depressed than you met him or her. So it's also what I believe every research team should consider. How do you frame your words? Don't give a lead answer when you are interviewing and all those things, when you are training your enumerators, so that you don't make them more depressed or get them more confused at the end of the research. We are going to note that, and we are going to also take into account how to capture that. So we are going to work with the respondents to be able to do the work, and also work with all the partners in Nigeria, which I know might also be the same for other countries. We are building a partnership, so a partnership that involves every kind of, including some foundations, to be able to manage expectation, to be able to push the entire thing, and have the findings of the research not being politicized at the end of the day. And I thank you all for these wonderful insights, which will help us to improve on the proposal and strengthen our research ethics. We'll be glad to have you back when we do what I call work in progress, to also continue the review as we try to achieve and make the world a better place for every one of us. Thank you very much.
Thank you so much, Uzo. We have only 2 minutes left, so Danseng, you've got a minute, if that's okay, to give a short response, and then we'll close, and then Kaz, very briefly.
Thank you. Very briefly, I think, yes, I think I have taken notes, and thank you for the insightful comments, and we'll review our proposals and put more details information. So that's one of my takeaway. And the second thing is about the method. I think what I mentioned is simple, random sampling method will not be, we impose more challenging for us during this time. So that's why I think we also think about doing it in a proportional, sampling method and things like that. So definitely, I think we'll have a deeper thinking on that, and come up with a better, methods which also reflects the ground situation. So I think thank you, and I think yes.
Thanks, Danseng. Kaz, any quick response from you?
Very,
and then I'll conclude.
Thanks. Yeah, thanks, Kathy. Thanks everyone. This has really been a nice moment for all of us after the work of preparing these previous months. Jimo, point taken on local context, that I'll make sure. And I think for me it's important that ethics, because this is a multi-country research project involving three countries. I think it's important to look at ethics at local, national level, and international or multi-country level, and I'll pay special attention to that because I'm sure local, national level it will work very nicely with my colleagues. But I think it's important to look at ethics all across the levels, and that'll be interesting to explore. Thanks, Kathy.
Great, thanks, Kaz. So there's a lot of feedback from the panel, but also in the chat. And unfortunately, we're out of time to pick up the things from the chat. But just a few points to pick from the chat. There's been some offers of, and I think some important points of thinking a little bit more. Jenny's talking there about the responsible data framework and just being able and offering that maybe a space to engage a little bit more with that. And how that works across then the ECID program as well. And then also thinking a little bit more about engagement and communication and feedback to the participants. So I think there'll be additional spaces in the future. But one of the points also, I think, in terms of the feedback that's given is very importantly the protocol for how do we do research in the context of COVID and where things seem to be maybe getting worse in some contexts. So I think being very careful and thinking through that, and ECID already has developed some guidelines around that to be considering, so we're not adding to the problem or putting anybody at risk, both participants and researchers and the organizations we work for. Kaz is going to have the delightful task, I think, of collating all the feedback and getting it from our panel and from the chat as well, and looking at future opportunities for engagement. So I feel like we could go on for a lot more and deliberate on more with some of the issues that has been raised, but I think it's been super helpful from the panel, Felicia, Patrick, Giles, Wanda, Jimo, just in terms of your feedback and some really important things to be thinking about. So for me, it's been very helpful, even just sort of from a stand back position and learning more about engaging with ethics. So thank you so much. Thank you to all of you who presented and who have been working on these research designs. It's really, it's a great moment to see how it's really all come together to get to this point, and then to Kaz for bringing it together. And thank you also to all the audience and the people who have been contributing on the chat. Very much appreciate your feedback, and please do feel free to take the conversation outside of this space.